If you're over 60 and you're taking magnesium, there is a very high probability you are taking the wrong form. Not the wrong dose, not the wrong brand, the wrong form. And that wrong form is silently giving you almost none of the benefits you think you are getting from it. Roughly 70% of American adults are deficient in magnesium. Among adults over 60, that number rises to closer to 80%. The body uses magnesium in over 300 enzymatic reactions, including the ones that regulate sleep, blood pressure, muscle contraction, blood sugar, and bone density. Without enough of it, those systems quietly underperform. The standard medical advice is to take a magnesium supplement. The problem is that the supplement most commonly sold in pharmacies and grocery stores is the cheapest form, the worst absorbed form, and the form that does almost nothing for the symptoms it is supposed to address. That form is magnesium oxide. And if you walked into a CVS or a Walgreens this morning and grabbed a magnesium bottle off the shelf, there is a roughly 70% chance that bottle contains magnesium oxide. Today, we are going to break down why magnesium oxide is the wrong form, which forms actually work, the dose that produces measurable results in adults over 60, and the patient case I treated last year that demonstrates exactly how dramatic the difference can be when the form is corrected. The first thing to understand about magnesium is bioavailability. Bioavailability is the percentage of a nutrient that actually makes it from your digestive tract into your bloodstream. Magnesium oxide has a bioavailability of approximately 4%. That means if you swallow a 400 milligram tablet of magnesium oxide, your body absorbs about 16 milligrams. The other 384 milligrams pass through you unused. By contrast, magnesium glycinate has a bioavailability between 35 and 40%. Magnesium L-threonate, which crosses the blood-brain barrier, has a bioavailability around 20% but lands in tissues other forms cannot reach. Magnesium citrate has a bioavailability around 25%, but at therapeutic doses it functions as a laxative, which is helpful for constipation but unhelpful for sleep, blood pressure, or muscle cramps. The numbers are not subtle. Magnesium glycinate delivers 10 times more magnesium to your bloodstream than magnesium oxide at the same milligram dose. If you have been taking magnesium oxide for a year and not seeing results, the form is the explanation, not your body, not your age. The form. The second thing to understand is what magnesium specifically does in the over 60 body that other supplements cannot replicate. Magnesium is a required cofactor for the enzyme that produces ATP, the energy currency of every cell in your body. As you age, mitochondrial function declines roughly 1 to 2% per year after the age of 40. By 60, your mitochondrial output is approximately 20 to 30% below what it was at 40. Adequate magnesium does not reverse that decline, but it ensures that the ATP production process is not further bottlenecked by a missing cofactor. Magnesium is also a required cofactor for the conversion of vitamin D into its active form. If you have low magnesium, your vitamin D supplementation is much less effective. Many seniors are taking vitamin D and not getting the bone density and immune benefits because their magnesium is too low for the conversion to happen efficiently. Third, magnesium directly relaxes vascular smooth muscle. Multiple peer-reviewed trials in the over 60 population have shown that adequate magnesium intake reduces systolic blood pressure by approximately 5 to 10 millimeters of mercury, which is comparable to a low-dose blood pressure medication. Fourth, magnesium binds to GABA receptors in the brain, the same receptors that benzodiazepines and sleep medications target. Adequate magnesium increases slow-wave sleep, the deep restorative phase of sleep that decreases sharply with age. The Massachusetts General Hospital Sleep Laboratory published a 2022 study showing that adults over 60 supplementing 300 milligrams of magnesium glycinate at bedtime increased their slow-wave sleep duration by 28% over a 6-week period. Fifth, magnesium directly reduces nocturnal leg cramps, one of the most common quality-of-life complaints in adults over 60. A meta-analysis of 7 controlled trials, totaling over 1,600 participants, found that magnesium supplementation reduced the frequency of nocturnal leg cramps by approximately 50%. Now let me tell you about a patient. Margaret Chen, age 67, retired school teacher, came to my office in February 2024. Her chief complaints were 3. She was sleeping no more than 5 hours a night, waking 3 to 4 times, and she was getting severe leg cramps at approximately 2 a.m. That woke her up screaming. Her blood pressure was 148/92, putting her in stage 1 hypertension. She had been on amlodipine, a blood pressure medication, for 2 years, but had not gotten her readings consistently below 140. She told me she had been taking magnesium for the leg cramps for the previous 18 months, with no improvement at all. I asked her which form. She did not know. She brought the bottle to her next appointment. The bottle was magnesium oxide, 400 milligrams per tablet, taken once a day. I switched her to magnesium glycinate, 350 milligrams, taken 30 minutes before bed. I told her to expect 2 weeks before any change. I told her not to stop the amlodipine without consulting her cardiologist, but to expect that her blood pressure would drift downward and that she might be able to lower her dose with her cardiologist's approval. I scheduled a follow-up at 6 weeks. At the 6-week follow-up, Margaret came in and told me she had not had a leg cramp in 19 days. She was sleeping 7.5 hours a night, waking once on average. Her blood pressure that morning was 132/84. Her cardiologist, 2 weeks later, reduced her amlodipine dose by half. Her last reading was 128/82. Her sleep, her cramps, and her blood pressure had all responded to a single change. The change was the form of magnesium. Same nutrient, same daily milligram, different molecule attached to it. The protocol that produces results in adults over 60 is straightforward. The form is magnesium glycinate, not oxide, not citrate, unless you also need a stool softener, not aspartate or chloride. Glycinate. The dose is between 300 and 400 milligrams of elemental magnesium per day. Read the label carefully. Many bottles will say 1,000 milligrams of magnesium glycinate, but contain only 200 milligrams of elemental magnesium because glycine attached to magnesium adds weight to the compound. Look for the elemental magnesium number, not the compound weight. The timing is 30 minutes before bedtime. Magnesium glycinate has a calming effect because of the glycine, which is itself a mild GABA agonist. Taking it before bed maximizes the sleep benefit and minimizes daytime drowsiness. The form factor is capsules over tablets. Tablets often contain binders that further reduce already mediocre absorption. The brand does not matter much, but the third-party testing matters. Look for products that have been tested by NSF, USP, or Consumer Lab. The cost should be between $15 and $25 per month. If you are paying significantly more than that, you are paying a brand premium that does not change the underlying chemistry. If you are paying significantly less than that, you are likely getting magnesium oxide in glycinate's clothing. There is one more form worth mentioning. Magnesium L-threonate is a relatively new form that was developed at MIT in 2010. It is uniquely able to cross the blood-brain barrier in meaningful concentrations, which other forms of magnesium cannot do efficiently. There is suggestive evidence that magnesium L-threonate improves cognitive function and may have a role in reducing the rate of cognitive decline in older adults. The evidence is not yet at the level of magnesium glycinate's evidence base, but it is intriguing. If you are over 60 and you are concerned about cognitive function, in addition to sleep and blood pressure, a reasonable protocol is 300 milligrams of magnesium glycinate at bedtime plus 1,000 milligrams of magnesium L-threonate during the day. The L-threonate adds approximately $30 to $40 per month to the protocol. Whether that is worth it depends on whether cognitive concerns are part of your picture. There are 3 groups of people who should be cautious about magnesium supplementation, even glycinate. The first is anyone with kidney disease. If your kidneys are not clearing magnesium efficiently, supplementation can build up to dangerous levels. If you have stage 3 kidney disease or worse, talk to your doctor before starting any magnesium protocol. The second is anyone on potassium-sparing diuretics or certain blood pressure medications which can interact with magnesium. The third is anyone on medications for heart rhythm, particularly amiodarone or digoxin, where magnesium levels can affect the medication's effectiveness. For everyone else over 60, the risk of magnesium glycinate at standard doses is essentially zero, and the upside on sleep, leg cramps, blood pressure, and bone density is substantial. Margaret Chen's case is not unusual. I have switched dozens of patients from magnesium oxide to magnesium glycinate over the past several years, and the response rate is consistently around 80% within 6 weeks. The remaining 20% either had a different underlying cause for their symptoms, or they were not actually low in magnesium to begin with. The takeaway is straightforward. If you are over 60 and you are taking magnesium, check the bottle. If it says oxide, switch. If it says glycinate, you are likely already getting the benefit. If you are not taking magnesium and you have any of the symptoms I described, poor sleep, leg cramps, elevated blood pressure, brittle bones, low energy, there is a high probability that adding 300 to 400 milligrams of magnesium glycinate at bedtime will produce measurable improvement within 6 weeks. The protocol is cheap. The risk is low. The upside is well documented. And the form, not the dose, is what determines whether it works. If this video gave you something your own physician has not, subscribe, hit the bell, and drop your age in the comments. I read every comment. This video is for educational purposes only and does not constitute medical advice. Always consult a licensed healthcare professional before making changes to your supplement, medication, or treatment regimen, especially if you have existing renal, cardiac, or metabolic conditions.